42nd Street in New York City. You're watching PIX Morning News.
All right, let's talk about the human body. It has about 206 bones, if you didn't know, and it's important too that we care for them so they last a lifetime.
Yeah, you need those bones, don't you? With the news of Alex Rodriguez and Tiger Woods having bone health issues, it makes one wonder if it could actually happen to active, healthy people. Why not the average Joe? Dr. Steve Salvatore here to clear it all up. Steve.
Hey, John, that's right. We need our bones. You're absolutely right. Tom Brady, Tiger Woods, A-Rod, they all have received injury reports that could get you worried about your own bone health. And since it's Patient Safety Awareness Week, we're going to educate you on some of those bone and joint issues that's been going on all week and discuss how common they are in non-athletes like us. And here to help us with that, Dr. Kirschenbaum. He's from the Department of Orthopedic Surgery at Bronx Lebanon Hospital. Thanks for coming in.
Thank you for having me.
All right, so let's start with A-Rod. We've been talking about it all week, so we have some hip models, which should help. This is a normal hip here. So talk to me about this one. What are we seeing here?
Well, what we're seeing right here is the pelvis and the femur bone.
Right.
The pelvis and the femur bone make up the hip joint. This ring around the ball and socket is called a labrum.
Right. And in A-Rod's case, he tore that, and that's what we see in this one over here. Slide that camera over right there, right?
Right, that's right. I'm going to mark out exactly the first stage of A-Rod's problem. The first, he had a tear of this labrum, which is the ring. And maybe you can see me lift that up.
Right.
And what the surgeons did initially, they literally just cut out that torn ring piece. So that wouldn't bother him, but that's just the beginning of his problems.
Right, because he had some other problems. He had a cyst, which we have a picture of over here, which they drained. But the big thing you were saying to me earlier is he has two forms of impingement. So let's talk about that.
Sure. The main problem that A-Rod has is really an osteoarthritis, or very early arthritis of the hip joint. The name is called femoroacetabular impingement, which is a very fancy name for having some extra bone where you should not have extra bone. This area in blue shows exactly what he has. He has bone on the top of his joint and bone at the ball and socket. And these will need to be removed to hopefully prevent further arthritis so he could continue his career.
Right. Now, you were saying that second one, the one in red, is the one that could possibly cause him to need a hip replacement, maybe.
Maybe. I mean, there is more than a 0% chance that he could require a hip replacement either during his career or later on.
Okay, so that's A-Rod. He's an athlete, maybe repetitive use injury, maybe repetitive use or maybe an injury. But you were saying to me earlier, it could be genetic. So what does the average guy have to worry about? Do I have to worry about something like this happening to me?
It's very rare for the average person, even if they had that problem with the bone in the wrong place, it would be very rare for them to even know they had it. Because A-Rod puts his body through such an extreme level of sports, these kind of symptoms will come out. But in the average person, they won't see this till they're 50, 60 years old.
All right, so let's move on real quickly to Tiger Woods. He had an anterior cruciate ligament injury. So point that out to us here. We'll get a close-up of this model here.
The anterior cruciate ligament is one of two major crisscross ligaments inside the joint. And he had what is a very common injury, which is a complete rupture of this ligament.
Okay, so real quick, what does the average person need to know about ACL injury so they don't have one themselves?
Well, it's almost an injury you can't avoid. It's very common, and it's usually dependent upon the level of sport. But to avoid it most is that the patient has to condition themselves before they do a sport. Even if you're a good skier and you go out and ski, condition yourself before you go out or you will be at risk because the ligament's going to take up the force that the muscles don't if you don't strengthen your muscles.
All right, a warning for weekend warriors.
Absolutely.
Dr. Kirschenbaum, thanks so much for coming in. Really appreciate it. Okay, if you want more information, log on to our website, WPIX.com/morning news. John Suki, back to you.
I really enjoyed that.
Yeah.
That was pretty cool.
Absolutely.